Hi, my name is Talane Mitchell. Do you mind if we record this video for educational purposes? Okay, so today I just want to ask you a few questions, a few personal questions, so I can get a little better history of any problems that you could be having, okay? So the first thing I want to ask you about is your current activity level. What's your occupation?
PCT.
Okay, and during any times of the day, are there periods where you're standing or sitting for prolonged periods of time?
All the time.
All the time? At your job?
Yes.
Okay. Is it sitting or standing or both?
Both.
Both? Okay.
But mostly standing.
Okay. What about any excessive lifting during the day?
Oh, yeah.
Yeah? Okay. Do you exercise?
50-50.
50-50? Okay. What type of exercises do you do?
Go to the gym.
Okay. How often do you go?
A week. Maybe.
Yeah, in a week. Once a week? Okay. Do you do any heavy lifting when you're in the gym?
45 pounds.
Okay. All right. Next topic I want to ask you about is your sex life. It's a little personal. Just a few questions here. Are you married, single, or in a long-term relationship?
Single.
Okay. Are you sexually active? Yes. Okay. All right. At any point, have you had any painful or bad sexual experiences?
Just when I had an IUD.
Okay. That was painful then? Okay. That's all about that topic. The next thing I want to know is about your past medical history or anything you have going on. Do you have any heart problems?
No.
Okay, so you don't take any medications for those. What about any neurological problems?
No.
Do you have diabetes?
No.
Any psychological issues such as depression?
No.
Anything like that? Okay, do you have any respiratory problems that may cause you to cough or sneeze obsessively?
No.
Okay, good. Next, I want to ask you a little bit about your bowels. Do you have any history of hemorrhoids?
No.
No? Okay. What about fecal incontinence? Meaning, do you ever notice you're not able to make it to the bathroom before you have a bowel movement?
No.
Okay. What about any GI disturbances like IBS, Crohn's disease, digestive issues, upset stomach? Okay. Do you ever get constipated?
No.
No? Okay, good. So next, I'm going to ask you about your gynecological history. Have you had a recent pap smear?
Yes.
Okay. Were there any significant gynecological problems like pelvic inflammatory disease, endometriosis, painful periods? Okay. Have you had a history of STDs or STIs?
No.
Okay. And if any, when was your last UTI?
2 weeks ago.
2 weeks ago. Is this something that happens frequently or infrequently?
No, it was actually my first.
Okay, your first one? Okay. Next, I'm going to ask you a little bit about your pregnancy history. How many pregnancies have you had? 2. 2. Have you had any miscarriages?
No.
Okay. How many children do you have?
2.
2. How was your labor with those? Did you have any prolonged pushing, any tearing, or any complications?
I had a C-section because my son went into distress.
Okay. Was that your first or second
My first.
pregnancy? Your first one. Any complications with the second one?
No.
Okay. And were they both C-sections, vaginal, or?
Both C-sections.
Okay. What was the weight of your children?
8, 13, and 8, 11.
And okay, I want to ask you about any history of Kegels. If you've ever heard of them, if anyone's ever told you to do them,
Yes.
how frequently?
My gynecologist, and she told me to do them every chance I could.
Okay.
After the kids.
Okay. Did she give you instructions on how to do them?
Yeah.
What did you say to do?
Oh gosh, she did hand gestures.
Okay. All right.
Of how I should move my muscles.
Those muscles down there. Okay. Do you feel like that helped? Were you able to do it correctly after
Yes.
she showed you? Okay, good. Okay, next I want to ask you about your bladder history. At any point of your life, have you had any urine leakage or any loss of urine during the day? Anything from a few drops to like completely wetting yourself?
No.
Okay. So you don't leak. On average, how often do you use the restroom for bowel movement or urination?
Bowel movement once and twice a day.
Okay.
And urination, I never really paid any attention.
Would you think maybe 2 to 3, 3 to 4?
3 to 4.
Okay. Okay. Have you ever experienced any feelings of like falling out, like your uterus? You feel down there, okay? Do you have any hesitation starting or stopping urination?
No.
Okay. Do you feel like you can completely empty your bladder?
Yes.
Okay. Do you have normal sensation that you need to move your bowels when you go? Okay. Do you ever have to strain to empty your bowels?
No.
Okay. Have you ever noticed any blood in your urine?
Only during the UTI.
Okay. But no other time
No
after
other
that?
time.
Okay. On a scale of 1 to 10, 1 being no urgency at all, 10 being you have to urinate this instant, what is your urgency when you have to urinate?
1 to 2.
Okay. In your adult life, have you ever went to bed?
No.
Okay. So next, I kind of want to ask you about your fluid intake. What's your fluid intake like?
About 64 ounces a day.
Okay. So that's good. So I'm just going to give you a little education on fluids. You're doing good. You want to drink 6 to 8 glasses a day. But if you can, we want you to push for 0.5 ounces per pound of body weight. So you do the math. You want to try to get at least that much. And you kind of want to stay away from the bladder irritants, things that's going to make you go to the bathroom more. So anything like coffee, tea, caffeinated sodas, alcohol, milk, or artificial sweeteners.
All the things that I like.
Right. Okay. And the last thing, are you on any type of medications?
Just Depo-Provera.
Okay, but nothing else.
Nothing else.
Okay, and the last thing I kind of wanted to discuss with you was proper postures for voiding and going to the restroom. So a lot of people think that they have to strain to go, but we don't want you to do that. The proper way is when you undo your pants, you want them to be at least below your knees. You want your legs as wide as you can because you want to get in a nice, comfortable position. You want your hands on your knees and slightly lean forward. You're going to take nice, deep breaths, diaphragmatic breathing through your nose, out through your mouth. You just want to relax. You want those pelvic floor muscles to relax so that you can void completely and without straining, okay? Is that something you think you can do?